Okay, in this short segment, I just want to talk about some famous drug families. We've talked in other segments about the ATC classification system and how drugs can be grouped together based on chemical similarity, mechanism of action, or disease use. And there definitely are some famous drug families that you will hear mentioned a lot. And in general, these are drugs for which millions of Americans and other people around the world are on. So one of the most famous ones these days are the statins. The drug industry has been kind enough to name drugs very frequently in standard ways. And so when I say statins, what I mean is there are drugs such as lovastatin, which was the first one that came out, simvastatin, atorvastatin, and it goes on. Drug companies often have Me Too products. So lovastatin came out. It was clearly going to be a very valuable drug because what these guys do is they lower cholesterol. Cholesterol is a risk factor for heart disease. In Western culture, civilization, there is a ton of heart disease in the developed world, and statins are used ubiquitously to improve cholesterol. Lovastatin was the first, but they were able to, other companies came out with look-alike drugs, simvastatin, atorvastatin. Often they were working on things like the strength of the drug and the dosing. You'd love a drug that's once a day and is very strong and has a big effect on cholesterol. And indeed, they succeeded, and the more recent statins are stronger and easier to dose than the earlier statins. So that's one famous drug family, and you will hear people talk about statins all the time. And you can look at their 2D structures or their 3D structures, and they do share a similarity, although as the medicinal chemists optimize them, the chemical similarity does begin to get more remote. And that's okay, but they're still called statins, and fortunately they are named in a way that practitioners can remember what they do just by their name. By the way, there are some drugs that end in statin that are not statins, and that's a disaster. That's a communication disaster, and physicians know what they are. Another very famous class of drugs are the beta blockers. These are called beta blockers because they block the adrenergic beta receptor, which is a key receptor involved in the autonomic system, involved in blood pressure, heart rate, and lots of cardiovascular parameters. And it became clear 50, 70 years ago that you could get some blood pressure control and you could get some heart rate control with these beta blockers. So these include things such as atenolol, propranolol. Propranolol was the first in the family. Propranolol, metoprolol. And once again, you see a little hint for practitioners by the alol. But we don't call them the alols. We call them the beta blockers, unlike the statins. So these bind the adrenergic. It's called the adrenergic, adrenergic beta receptor. And these are a famous class of drugs. Third famous family I just wanted to mention are the SSRIs. These are selective serotonin, I think it's serotonin, but I'm not sure about that. Selective serotonin reuptake inhibitors. SSRI. These are antidepressants. Prozac is a class in this class, which is fluoxetine. It also includes a drug Paxil, which is paroxetine. But I must say it also includes, so you might say, oh, these are like viatines. But I must say that in recent naming, there have been SSRIs that have not followed that naming category. So we don't call them viatines, we call them the SSRIs. They're a powerful new class of antidepressant, came on the scene about 15, 20 years ago. They have really revolutionized the treatment of depression. And there are many others, but I just wanted to acknowledge that these are some of the families that you'll hear people refer to, and they won't refer to the individual members of the family. In general, the mechanism of action, the MOA, is conserved within a family. The chemical structure, I'll say it's plus minus similar, although they begin to diverge often. And then, of course, the diseases for which they're used tend to be shared as well. So shared mechanism of action, shared chemical similarity, and shared disease use. And as I said, we have cholesterol lowering, a huge public health problem, blood pressure and heart rate control, a huge public health problem, and depression control. And there are other drug families, but I just wanted to acknowledge that this is a thing that happens in pharmacology.